Welcome back to the Business of Aesthetics podcast. I'm Don Adeesha, your host, and I'm excited about today's episode. As a practice owner or surgeon, you're constantly balancing immense patient demand with the highest standard of care. There are producers that define an era of aesthetics. They're wildly popular and can be incredibly profitable. But what happens when one of the most in demand procedures also carries a well-known serious risk? It's that moment where you realize that leading the industry isn't about offering what's popular, but about pioneering what's safe. So, to help us navigate this, we are honored to be joined by a surgeon who is leading that exact charge, Dr. Alexis Delobaux. Dr. Delobaux is a world-renowned plastic surgeon, a true pioneer in high-definition body contouring, and the creator of the groundbreaking SMART BBL. Today, we are diving into our topic, Beyond Blind Injections, how Dr. Delobaux' SMART BBL is redefining safety and liability. We'll explore the shift from blind technique to visually guided standard and the profound impact that this has on patient safety, clinical outcomes, and the business liability of offering this procedure. And as a special thank you to our sponsor, Equa Marketing, today is all about pioneering a new standard of care. To help you attract the patients who value that commitment, Equa is offering a complimentary high-value patient growth plan session. Build your roadmap for growth by securing your spot today at www.businessofesthetics.org/MSM. It only takes 90 seconds to sign up. And with that being said, Dr. Delobaux, it's a true honor to have you on the show. So let's jump right in.
Hello, Don. It's a pleasure and an honor to be here with you today. I would like to thank you for your invitation and for the organization of this amazing podcast. And thanks a lot to your team for putting the effort to organize everything. And this is, one of my favorite topic, the BBL. And what we do today has nothing to do with what we were doing like 10, 20, 25 years ago. The BBL has been around for the last probably 40 plus years. It started in the 80s in Brazil, as you know. This is the country of BBLs, as well as South Florida in the US, which is probably one of the area on Earth where you have the most important number of BBLs, actually. And this is also where we started to change our standards of care, the procedure, the kind of technology we use today to perform the BBL surgery, which is a beautiful surgery, and it can be safe if you do it properly with the following the recommendations and using some nice technology. So happy to be here and happy to speak about one of my favorite surgery.
Absolutely. Thank you very much for that brief history on the BBL surgery itself. And with that being said, let's come right now to today, right? So, what specific anatomical risks of the traditional blind BBL led you to develop a new standard of care?
That's a really interesting question. This is something we speak about in every congresses where I give a talk about the BBL and the new technique, the SMART BBL, in which we use the ultrasound. So it became an ultrasound guided surgery. It was a blind surgery before, and we had a lot of discussions in the last 10 years. It started in 2015, 2016. We started to see a lot of tabloids in Brazil, in Miami, in South Florida about deaths after BBL, as well as in Turkey and the UK. And we had some group of experts, task force, on how we could avoid this risk of fat embolism. Anatomically speaking, the risk comes from the big veins that you have below the muscle. So when you think about the anatomical layer on the butt, so you have the skin at the top, And then just below, you have a small layer of fat. This is what we call the superficial subcutaneous compartment. So this is the superficial fat. This is the fat that you can pinch through the skin. And then you have a layer that separates the superficial fat from the deep fat. So in every area, the two areas I just quoted, you are safe to put fat because there is no risk of entering a big vessel, like a big vein or a big artery. So there is zero risk of having any trouble when you inject the fat in this area. And below this area, this layer, you have the muscle that you can pinch when you contract a lot. And below this muscle and inside the muscle, you have big vessels because the butt muscle, the gluteus maximus, the big muscle of the butt, needs a lot of blood flow to be irrigated. And this blood flow comes from arteries and veins, and you have big veins, the deep gluteal veins, and the risk is to blindly cross the muscle and enter the muscle and creating a breach into the vein because the vein is really fragile. I mean, if you enter a cannula, a metal cannula inside the vein, you can create a breach. And if you inject the fat around or inside, it doesn't need to be inside the vein, it can be around the vein because you have a negative pressure. So you have a force of aspiration, and the fat surrounding the vein can be aspirated into the vein, and it heads directly up to the heart and the blood vessels of the lung. So you can have what we call PFE, pulmonary fat embolism. So everybody knows about the deep vein thrombosis after pregnancy, after any surgery. So this is a blood clot. But we are not talking about a blood clot. We are talking about a fat clot that goes into the vessel and goes into the big vessel of the heart of the lung. And when you have this, it can be a deadly risk. Many people died because of that. We had a lot of studies made in Mexico, Colombia, and also in the US, reporting dozens and dozens of deaths because of the migration of some fat into the vein on the big vessels of the heart and the lung. So this is really an anatomical problem, and the risk is to do the procedure blindly. This is what we were all doing like 10 years ago. So you feel the layer with your hand, and with the other hand you enter the cannula. So you hope you are not into the muscle, and most of the time when you enter the muscle, there is a resistance. So you can feel that you are in the wrong part of the butt, you are too deep. But sometimes the muscle is kind of weak. And in some patients, especially young ladies, really skinny, really lean, if they don't train a lot, they have a really thin layer of muscle. And sometimes you don't feel with your hand that you just cross the muscle and you enter the muscle and you don't know you're inside because you have no idea about where you are. You have no technology to check where you are. There is no possibility to make sure that you are above the muscle and not inside and below the muscle. So this is really an anatomical risk related to the different layers on the butt.
So, doctor, as you were mentioning, I couldn't help but wonder, like, in the traditional method, you will only know if it's wrong, right? If you were to puncture to the muscle, that's the only way you would know you're wrong. And until that point, you're just hoping through your experience that you're right. And if, as you mentioned, in
Exactly.
younger
Yeah,
ladies, it might be a bit lean, the muscle, and why it's almost sounding like it's set it up in a way that is very risky when you're doing it so blindly, even though you might have a lot of experience, because your only safety is when you go wrong. Am I understanding that
exactly. This is
Okay.
Yeah, this was a problem before. I mean, we had no possibility and no technology, I mean, at that time, to help us to know whether we were in the right or the wrong space. And when you are in the wrong space, the traduction of the fact that you are in the wrong space is really, really deadly. I mean, you directly see all the monitors, the control that we use during the surgery changing, and you see that there is a problem. I mean, the anesthesiologists tell you that there is a problem. And if you are not aware of that risk, you can just wonder what's happening to my patient during the time you operate patients. So some anesthesiologists just put the diagnosis, but sometimes you don't know what's happening. So you send the patient to intensive care unit, or worst, you can have your patient having a cardiac arrest during the surgery. And if you don't know why, it's even harder to treat and it's even harder to save your patient. So yeah, it really comes from the monitoring of the procedure, the imaging of the procedure, so you can monitor exactly where you are into the butt in real time. This is what's important because
No,
you
doctor. Sorry about that, but I would like to know before we move on from this. I would like to know what moment during your practice, your career, that you saw that okay, um, there has to be a safer way to do this. Can
mm,
we get into that moment exactly? Was it in
yeah,
the
yeah,
operating theater or
it's a
what
really
was
good
that?
question. I mean, I had a patient, I think it was in 2019 or early 2020, and she told me, "Look, doctor, I've seen all these tabloids from Turkey, from the UK, from South America, talking about the risk of death during this procedure, and how can we prevent that?" And honestly, I didn't know what to say because at that time I was not aware about a solution, and I was not aware that you had the possibility to use the ultrasound during your procedure. So I started to question myself, and I thought, wow, it's true. I mean, this is an aesthetic procedure, and you shouldn't have this kind of risk just to have a more beautiful appearance of your butt. I mean, it's a high risk compared to what the procedure brings to your life and your everyday life, and to your self confidence. I mean, so what can we do? So I started to do some research and to find some articles about uh, first the anatomical risk and the reports and what happened and what kind of problem the other surgeon had during the surgeries. And I think it was an article written by a colleague of mine in the US, and I saw the report on the task force. So you have the American Society of Education and Research Foundation. I think they had a task force in 2018. So they gathered a lot of experts around this topic, the problem of pulmonary fat embolism, following a lot of reports of deaths in the last 10 years. And they were reevaluating the technique. So at the beginning, they were thinking about the position of the patient during the surgery. They were thinking about the size of the cannulas. So they were thinking about many, many different aspects of the surgery, about injecting in motion or not in motion. And they gave us some recommendations in 2018. So I followed the recommendation, use big cannulas above 4 millimeters. Try to keep the cannula superficial. Avoid locked cannula, Luer lock cannulas. Prefer some intergluteal incision. Jackknife the patient when it's prone. Only inject in motion. Many, many recommendations. And in the end, I think 1 or 2 years after, they published a new paper saying that even with all these recommendations and even with surgeons following the recommendations, they still had some deaths and some pulmonary embolism. And they could find fat graft into the muscle, even if the surgeon followed the recommendations. So we started to consider that the problem was not a problem of technique. It was not a problem of cannula size, a problem of injecting in motion or not. And even in 2018, the BAPS, the British Association of Plastic Surgery, they banned the BBL from the country in the context of the death of a young lady, 29, 30 years old, coming back from Turkey. So it was a unique decision amongst international plastic plastic surgery societies. So we started to study more the anatomy of the butt, and then came the ultrasound. And we realized that we could see the cannula and use the ultrasound to see the cannula during the procedure. So it really started from the question from a patient. Like, I'm a mother, and there is a risk, a deadly risk for this procedure. I really want to do the procedure, but I don't want to take this risk. It's too much for me. Yeah. And as a surgeon, you think, okay, yeah, this risk is really big. There might be something to avoid that risk. So I really started to question this in 2019, early 2020.
I think for many of our practice owners and people in the aesthetic industry, this is such a key point where from a patient, the feedback you get, right? It can be so quality that if we actually take the time to listen to it and figure out a practical solution to that problem instead of perhaps, just brushing it away, you might be able to be, find that next new trend or pioneer that next new procedure, uh, as Dr. Alexis have done over here. Now, let's move on to that procedure, right? Now we found out ultrasound was and just it's kind of like finding gravity, to be honest. Now, if we were to look back on that procedure, right, doctor, it seems almost like, why haven't we been doing this for longer, right? It seems like the simple answer, but as you mentioned, from the history of things, it wasn't so. There were a lot of things that had been tried before and recommended that failed to address the main problem, which is we won't know until it goes wrong. Uh, yeah, so thank you very much for that brief history lesson on the procedures bringing up. Now, how does real-time ultrasound transform the BBL from a tactile, field-based procedure into a visual and data-driven one?
I mean, for me, it was kind of a revelation. And if you ask me today to do a BBL without ultrasound, I will be like shocked. Even if we still encounter some resistance. I mean, I do probably 10 international congresses a year. And sometimes you have resistance from the audience. You still see some presentations on BBL without ultrasound. So this is our role to keep telling our colleagues that even if you are an experienced surgeon, you still need to be updated with the latest data. And in some countries, it's still not mandatory to use the ultrasound. But from my point of view, I would say that switching from something that you can feel with your hands to a screen where you see the anatomy, where you see every little anatomical layer, when you see the skin, the superficial fat, the deep fat, all the fascias. I mean, first, you add value to your practice because it's not only in the operating room. You can use it during a consultation to show your patients on the screen the anatomical layers and why it's important to inject in this anatomical layer in this subcutaneous space and not in the muscle where you have the risk. So first, it's safety. So you add value to your practice. That's really important because the patients, I mean, I have a lot of patients coming only because I use the ultrasound. I'm not better than another. They just tell me, doctor, I made some research. I've asked ChatGPT, I've asked Google. And they tell me that you are one of the only surgeon to do that in your area. So I want safety for me and for my surgery. So I chose you because of that safety. And honestly, I feel it really um, rewarding to get involved in a new technique, in a new technology, to spend time to get the training, to get used to it, and then you give it back to your patients because you're safer and you're a better surgeon. In the end, it makes you a better surgeon. Technically, you learn a lot because using the ultrasound at the same time you operate, it's kind of technical. So if you like the technology, if you like to be really precise, it's definitely made for you, and it's really fast. And in the end, when you end your procedure, you are 100% sure if you check everything during the surgery. And in some states in the US, it's mandatory to keep the recording of the procedure to prove that you use the ultrasound. It's not like mandatory in France and in many other countries in Europe, but when you get back home, you feel safe. You don't worry about fat embolism because you just watch what you did and you saw the different layers, you saw the cannula. So I feel safe, and I feel released from this pressure. Imagine if I have to think about the death of my patient after every BBL, like it will be like really hard to handle that pressure. So you feel that you bring more value to your patient, you bring more safety, and you can also measure the amount of fat, the thickness of the fat, the difference between before and after the procedure, and you can target specific zone in the butt, because what we didn't talk about is the deep subcutaneous space is a space of low resistance. So, for example, sometimes you have patients coming to your office and they complain about the cellulitis aspect that they might have after a BBL. And when you target the deep subcutaneous compartment, you are below the superficial layer. You are in the deep subcutaneous layer. So you avoid the risk of having this cellulitis aspect and these deformities on the surface of the skin. So this is a secondary benefit of using the ultrasound. And apparently, as a space of low resistance, you have a better fat survival. I'm really cautious on that because there is no study proving that you have better fat survival on this area. But this is something we are actively discussing. And you can also, with the use of ultrasound, release some bends, some fibers that you see. You can see it on the screen of the ultrasound. So you can release the cellulitis aspect. You can expand and pre-expand with the use of ultrasound the area where you're working.
Right. And doctor, I was just listening to this and I was really fascinated by it. When you speak about this, you speak so passionately, and there is a certain sense of artisticness in it. Um, Doctor, earlier on, you mentioned that there is a bit of resistance from your colleagues. But having you here, and speak about this, it's really difficult to get my mind wrapped on why are they resistant. Can you speak a little bit about that? Why might they be resistant, and how, like, we could change it? I mean,
I guess that in the story of humanity, I mean, it's not new. Every time you have a new technology, a new concept, it can be a philosophical concept, it can be a general concept, a social concept. Anything new, I think it's in the genes of humanity to resist the change, because what you what you have to consider is that surgeons, they rely on empirism. They rely on what they have seen before, what what they think is working for them. And when you bring a new concept, a new technology, it means that they have to change their mind, they have to change their beliefs. And humans, they need beliefs, they need something they can hold on to feel secure. So when you change the concept, when you change the beliefs, when you evolve, when you challenge the concept, you always get resistance. And I was discussing this concept with Claude Leloir. He's a famous plastic surgeon in France. He invented some well-known techniques that everybody is using now. And he told me it took me 10 years, 10 years of my life, 10 years of walking alone in the desert to spread the knowledge, to explain to my colleagues why it was this technique and why you had to do this in this particular indication. And at the beginning, everybody was telling him, look, it's crazy. So it's the same. It's impossible at the beginning, and then it's crazy, and then everybody wants to do it. It's the same. You have like the same frame, the same pattern for every new technology, every new concept. Crazy, impossible, and not impossible, crazy, and then everybody wants to do it. And he told me it took me 10 years, and I started to be recognized outside of my country, so outside of France, for this technique, because you are recognized like in your country at the very last moment. At the beginning, you are seen as an innovator outside of your country, and then when it comes to your country, it takes ages. And yeah, this is the natural resistance of every human being to novelty. So we have seen it for many technologies, for the use of ultrasound assisted lipo, for the use of power assisted lipo, for the use of radio frequency device. So using the ultrasound, I mean, when you speak about the ultrasound into congresses, I always ask at the beginning of my talk, who here is using ultrasound for the BBLs? And when it's in European countries, I think about France, Germany, Belgium, etc. You have a very small amount of surgeons using ultrasound. I was invited in Germany like 2 or 3 years ago to speak about the ultrasound during the BBL procedure. And I could feel in the audience that it will take a lot of time for them to implement the use of ultrasound in their practice. And I could feel the resistance. So most of the time, experienced surgeons, they tell you, I've done 500, 1,000 BBLs, and I never had any problem. Yes, probably. I mean, it's just the statistics. You can do 100, 200, 300, 500 and having zero problem. But the thing is, the day you have a problem, what will you say to your patient? Because there is a possibility to avoid this risk. And it's the use of ultrasound. Yeah. So it's the same. I always tell them, would you consider to have a biopsy in the lung without tomography, without imaging? I mean, we were doing it like years and years ago, but nobody will do it today. So now it became the standard. But for this new technique to become the standard, I mean, not amongst international societies because it's already the standard, but in the mind and in the beliefs, it's going to take a lot of time.
Absolutely, Dr. Alexis. And as you mentioned, I saw that even Florida now mandates the use of ultrasound for BBL procedures. And but of course, as you mentioned, beliefs amongst the practitioners might take a little bit more longer than that. And of course,
human beings are resistant to novelty and to new things.
Change and novelty, absolutely. And to our practice owners and plastic surgeons listening to our podcast, absolutely, this might be your gateway into buying that ultrasound for your practice. Because as Dr. Alexis just mentioned, how much benefit it can bring just with this one treatment alone. So it's not just safety, it's also the procedure's result actually takes to the next level as well. So now, Dr. Alexis, beyond preventing embolism, how does the precision of SMART BBL improve other outcomes like fat survival, symmetry, and contour regularity? You mentioned this a bit in brief, but let's dive a little bit deeper into it.
Hmm. This is something really interesting because when you start to use the ultrasound, you realize how versatile is this tool. Not only, as I mentioned, during the surgery, but before, during, and after the surgery. So when I started to implement this in my practice, I wanted to um, get my knowledge refreshed. When I was a resident, I had a chance to use ultrasound, not for BBLs, but for vessels mapping in reconstructive surgery. So we were using this big device, like 1.5 meters, 1 meter wide, and we had to borrow the big ultrasounds from the anesthesiology department. And it was a big tray, like 50 kilograms, and we had to push it in the corridors. And now you have the ultrasound in your pocket. I mean, I have one that there I can show you, but it's the size of your smartphone, so everybody can have it. So it's really light. It's wireless, so you can have it in your pocket and you can use it as I told you before the surgery. So during the consultation, you bring value to your patient because you show them their anatomy. You show them the different compartments into the butt. You show them the superficial fat layer, the deep fat layer, all the fascia and the aponeurosis. You show them the muscle. You can ask them to contract the gluteus maximus, the muscle of the butt, to show them why it's important to be above the muscle and not inside the muscle. And you can also explain them not only the importance in terms of safety, but also in terms of aesthetic results. Because if you are in the deep compartment, you won't have this cellulitis aspect because you can really go deeper without any kind of specific risk because you see where you are. And this is really interesting because when you have a patient coming to you and say, look, doctor, I'm really interested in having a BBMs, and I'm really happy that you use ultrasound because of the safety, but I'm concerned about the cellulitis aspect, the irregularities on the surface of the butt that you see in some BBLs. And you can explain them, look at your anatomy and look at this layer, we're going to be below. So it's going to be like a mattress to hide the potential irregularities, and we will be deeper. So then you cannot see this cellulitis aspect because the fat will be deeper. And also what you can do is targeting first. This is what I do in my everyday practice. You put the fat into the deep compartment of the butt. And it's like a butt implant of fat. So you gain some projection on the butt. And we realize, and it has been published in anatomical and cadaver study, that this deep compartment, it's not the same as the superficial compartment in terms of resistance and in terms of pressure. And what you see when you put the fat into this deep compartment, you see the fat flowing on the side. It means that you don't need to move your cannula. So you are even safer. Even if you have the ultrasound, you are safer because you are not moving. Why? Because this compartment is connected to other small compartments into the deep space of the butt. And because there is no resistance, you don't need to move your cannula during the surgery to equalize the fat. The fat equalizes itself. And you don't believe it until you see it. Once you see it, it can be unseen, and you see the fat flowing everywhere, and you see the expansion, and say, wow, everything is connected inside the butt. So the ultrasound brought us a new understanding of the butt anatomy. So it helps us to get more projection, deep projection. So in terms of aesthetic outcomes, it's really interesting for us as plastic surgeons. And also to prevent some contour irregularities because you don't have this superficial fat just below the skin, which is not beautiful, I guess, for most of us.
Absolutely. Yeah, absolutely. I mean, that's one of the biggest concern a patient might have. How are they going to end up looking like? Are they going to have lumps? Are they going to have
Yeah.
asymmetry? But now, with the smart BBL technology, you can really, uh, starting with the consultation itself, you can show them this is what we are going to do and this is how it's going to spread out. And you're going to achieve that natural and very beautiful aesthetic look that you are, looking for safely at that too. So, of course, and this segues into our next question perfectly from a business owner's perspective, Dr. Alexis, right? How does Smart BBL standard impact a clinic's liability, the informed consent process, and the patient's trust?
Yeah, that's really interesting. Especially in the US. I mean,
Yeah.
we talked about it just before, but in July 2023, the Florida state, I'm not talking about the Florida Board of Medicine or the Aesthetic Society or the Plastic Surgery Society, the Florida state, and it's historical because for the first time, a state mandated and released a bill into, you can find it on the Florida Senate, in July 2023, Plastic Surgery Bill, HB 1471, HB 1471 mandated the use of ultrasound guidance for every BBL. Otherwise, if you don't do it, and if your patient complain about it, you can lose your medical license. And some plastic surgeons, they lost it because they didn't use the ultrasound. And they had 1,000, 1,500, for some of them, 3,000 cases of BBL without any problem. Only one patient, and you lose everything. So does it worth it? No. Why? Because the ultrasound device is less than $3,000. What is the cost of your license? I mean, what is the worst of your license? What is the worst? I mean, it doesn't worth it to take the risk. For a simple device, you can train every day if you have a radiologist friend, and then you can train on your staff. You can train on your family because there is no radiation. You have it in your pocket. You can use it as many times as you want, and the extra cost for your practice, it's just the price of the device, and then it's a sterile cover. It's $5 on Amazon. So in terms of reputation, in terms of risks, in terms of value perceived by your patient, imagine if you are one of the first in your city, in your neighborhood to have the ultrasound and to be trained and to be someone who is speaking about it and using it every day. It brings you a lot of trust. It's good for your reputation. You avoid the risk of losing your license, which is something really important. And yeah, I mean, you can use it for many other surgeries. I mean, I use the ultrasound every week. You can check your patients after the surgery. If you think there is a complication, you could check if there is a seroma, if there is an hematoma, and you can react accordingly and faster because you don't depend on a radiologist for small things that can happen after a lipo, after an abdominoplasty, after a BBL. So you have the technology in your hand. So in terms of standard of practice, even for your staff, they see you as someone who is up to date, someone who is trained, someone who has technology, and someone who can solve directly the problem when you have a seroma or something. So yeah, there is no reason not to use it today. When you go to, for example, the IMCAS in Paris, biggest congress in the world in aesthetic and plastic surgery. I mean, even in the injections for fillers in the face, they developed a device that you can put on your fingertip. There is a little probe at the end of the tip of the device. You just put it on your finger, the second finger, and you see the anatomy. with the device, and then you can see where are the arteries on the face. So even with small procedures like that, we're not talking about operating room, going in for general anesthesia, etc. It's just in your office for fillers, and some doctors, they use it. So first, I mean, the most important thing is to be safe. And if you're not safe, you can use a license. So we can just think about it. What's the price of my license? And yeah.
What's the price of my license? Absolutely. I
Yeah.
really like,
Especially
you
if
know,
you're in the US. Yeah.
yeah, especially, I mean, right next to Florida, like if you're there, this is something to consider. And I was just curious, just to really double down on this. How has your conversation with the patient changed when you discuss these risks, for a smart BBL versus the traditional one? Like, how has that changed? How has that really empowered the patient? Because we're looking at the
Mm.
informed consent process.
Yeah, that's really important. In France, it's really strict. I mean, you have to inform your
Mhm.
patients about the risk, and you cannot skip that risk. I mean, you have it in the tabloids, you have it in the news, you have it on Google. And now I find out that probably 20% of my patients they check on ChatGPT before coming for a consultation. So probably a third of them are asking me about the ultrasound because they found me because of that. So I have to tell them, look, I use it for a few years now. I was the first in France to use it, and I train people to use it. So I'm quite familiar. I use it for all of my procedures all the time. We have two devices just in case there is one which has a problem. I can have another possibility to use it. My anesthesiologists use it for the nerve blocks, and I tell them, look, there is a risk. I mean, even they are not informed and they are not aware about the risk of pulmonary fat embolism. I always tell them, if you don't inject in the right layer, if you are too deep, if you cross the muscle, you can die from your BBL. And 2/3 of my patients, they don't know about it. They just think it's a light procedure, a small procedure, but no, it's one of the riskiest procedure, and they need to know it. And I don't tell them that there is zero risk with the ultrasound, because at the end it depends on you, on your training, on your experience, on the use of the device. And I always tell them, look, to my knowledge, this is the safest way to do it. There is data confirming it, but this is not a zero risk. It's a surgical procedure, so anything can happen. And even if I use the ultrasound, the risk is not zero. We are not far from zero, but it's not zero. You cannot tell them zero, because maybe in 10 years, we're going to show that even if you use the ultrasound, you can just interpret the ultrasound, for example. I don't know. To my knowledge, never happened when you use it properly, but we never know what's coming in the future. So I prefer to be really careful to what I say to the patient.
Absolutely. Sharing that risk that comes with the procedure, it's very crucial. And having the ultrasound just enables the patient to have a visual, something very tangible for them to understand and take away and make that consent decision. Now, when we're looking at the future, you just touched on it very lightly, but let's dive a little bit deeper on it, right? Will the traditional blind BBL soon be considered below the standard of care? And why is mastering this guided technique essential for future proofing a practice?
Yeah, that's a good question. I mean, we have this discussion in every congress, and now I mean, I told you about the Florida state, but before the Florida state, I mean, we in Florida, not in Florida, but in Florida, we as a plastic surgeon, they released, I mean, the Florida Board of Medicine, they released an emergency rule of 90 days of mandatory use of ultrasound, and they also limited the number of procedures you could do per day, because in some high volume clinic, they were doing 5, 6, 7, 8 BBLs per day, and it was not the same person operating in every room. So they released emergency rules. And then I told you the British Association of Plastic Surgeons, they banned the BBL. And then they reintroduced it with the rules from the Florida Board of Medicine. So they mandated the use of ultrasound for every BBL. And amongst international societies, it's now proved and published that the safest way to do a BBL is with ultrasound. And this year I was in Singapore for the ISAS meeting. You still have people who are not using the ultrasound for the BBL, and they present on it. So you have the moderator saying that, look, we recommend ultrasound for the use of every BBL. So it's well established now in most of the plastic surgery societies that this is the new standard of care. This is the gold standard for every BBL. This is an aesthetic procedure. We are not talking about reconstruction. We are not talking about something paid by the social insurance or whatever. And it's proven that the ultrasound make the procedure safer. So there is no reason not to use it. There is no extra risk. You have a small cost, but I mean, we are talking about the life of our patients, So there is no discussion about it because there is no risk, no extra risk when you use the ultrasound. You have this resistance because of the adoption of a new technology, the learning curve as well, because you need to find someone who is trained, or you need to find a radiologist or whatever. So this is why we have resistance. But in the end, ethically speaking, when you know that there is data proving that BBL is dangerous when it's done blindly, as a surgeon, is it really what you want for you? Do you really want to take this risk and to be a more dangerous surgeon? It's between you and you, but it's clear amongst international societies that this is the thing that you have to do. Use the ultrasound.
When it comes to that learning curve, Dr. Alexis, how long do you think it would, on average, take a plastic surgeon to learn and adopt this technique?
Yeah, that's a good question. I mean, when we train on liposculpture and some advanced techniques, we have a lot of questions about how long does it take, how many procedures, and the answer is different for every surgeon. The answer is different for every technique, every difficulty. What I like with the ultrasound is that anyone can buy a device. You don't need to go to a specific process. You can buy it on the internet, and the week after, you can use it on yourself. You can use it on your wife, on your kids, on your staff, and you could start to get used to the images, to get used to the anatomy, to get used to the fatty layer. And we even have a special software. There is a brand, I'm not going to quote it, but they have a software specifically dedicated to BBLs, and you can, with the AI, you have the different colors depending on the layer where you are. So it's even easier with this kind of tool of software, specifically designed for BBLs. So it makes it much easier when you're beginning. So I would say in a few months, you can be totally autonomous for your BBLs. And if you are really, really motivated, you can just come to a training. I mean, your learning curve is not a straight line, and you will have ups and downs, but you really speed up the learning curve when you go to see an expert, when you touch the patient with him, when you put your hands on the device. I mean, I remember two years ago, I was training a English plastic surgeon working in London. And we did together his first echo-guided BBL, and was like, wow, amazed by the technology, amazed by what he could see on the screen. And it really gave him confidence, and he really felt good about the technology, and he realized that he could do it. I mean, when you think about it, if you have never tried the technology, if you are not used to the ultrasound, if you are not familiar to, I was lucky because during my residency, during my 5 years, I used the ultrasound. So I was really used to check for the different layers, check for the little vessels. And it's much easier to see the layers of fat than the small vessels. So it's kind of easier for me. But still, I needed some training. This is why I called a friend who is a radiologist, and he helped me to train and to get used to the images. But yeah, I mean, in 3 months, you can really get used to it, and you can do your first cases. But I would definitely recommend to go and see an expert in the OR and see the different tips and tricks and how he's using it in the everyday practice, because there is nothing more valuable than the direct experience from a colleague, because you can ask the questions in real time and you can use it with him. So yeah, training is essential. And then you have your staff, you have your family. You can use it on you as well to get used to it.
Absolutely. And Dr. Alexis, we are approaching the end of the podcast. Now, I always like to ask our guests, what's the key takeaway you would like for our listeners to have?
The first word coming into my mind is safety. Safety, safety, safety. We are not treating patients with a disease. We are beautifying the patient. We are giving them back the shape, the confidence, a new look, a fresh look. And we shouldn't risk the lives of our patient, especially when you have a solution, when you have the technology, when you just need a few training, a couple of thousands of dollars. It doesn't worth it. I mean, we're here to help them in their journey, in their life, and yeah, we cannot take the risk of spoiling their life or having them dead because of an anesthetic procedure. You have risk in any procedure. I always say that there is no little surgery, there is no little procedure. But when you have something with data, with scientific proof, can help to lower the risk, you should consider it. At least try, give it a try. So safety first.
Safety first, and just give it a try. I think really appreciate your insight there, Dr. Alexis. And yeah, thank you so much for sharing your pioneering work and expertise on our topic beyond blind injections. Your insight definitely redefine safety with SMART BBL, provide a clear and essential blueprint for any practice offering high-level body contouring today. So, and I would like to also thank our listeners for always tuning in and giving us the privilege of your time. We truly appreciate it, and your continued support and love, being able to bring these conversations that help you grow your business and navigate the world of evolving aesthetics. So if you enjoyed this episode, please share it with your colleagues and take a moment to leave us a review on your favorite podcast platform. Your feedback helps other professionals discover the podcast and gain valuable industry insights. Finally, a quick reminder to take advantage of the complimentary high-value patient growth plan from our sponsor, Equa Marketing. If attracting more high-value patients is your priority, secure a spot today at www.businessofesthetics.org/MSM. With that being said, until next time, keep learning, keep growing, and keep building the kind of business that truly sets a standard in aesthetic medicine. Thank you.
Thanks a lot, Don. It was a pleasure.